Hi, my name is Ali Ramis, and today I will be discussing an important issue in the critical care units. The issue I will be focusing on is delirium occurring in ICU patients. I'll be summarizing a research study focused on improving delirium detection and management through a standardized assessment tool. Delirium is a serious and often overlooked condition that affects intensive care unit patients. It is linked to longer hospital stays, higher mortality rates, and long-term cognitive decline. This study aimed to achieve two key goals. First, to implement the confusion assessment method for the intensive care unit, or CAM-ICU tool, as their standard screening tool. And then to also reduce the use of high-risk medications, which are specifically opioids and benzodiazepines. So, moving forward, to understand why this study done was so important, we will look at what we already know about delirium in ICU patients. So, delirium does affect at least 1/3 of all ICU patients, and nearly 80% of them are ventilated patients. These symptoms, they can last for weeks or months, but often resolve once the underlying condition is treated. So certain risk factors make patients more vulnerable, including severe medical conditions, such as sepsis or respiratory failure, metabolic imbalances, elderly patients, so over the age of 65, history of dementia, and the use of high-risk sedatives, especially whenever it's not necessarily appropriate to use these medications. So opioids and benzodiazepines, while they are commonly used, they can actually worsen delirium because they can cause oversedation and confusion in patients. Delirium is not just a short-term issue because it does lead to prolonged hospital visits, higher risk of these patients being re-intubated, increased morbidity and mortality, and a greater chance of being discharged to places like long-term care units instead of these patients going home. And despite all this, delirium is often under-recognized and mismanaged in the intensive care unit settings, which is why this research was so necessary to be completed. So, why this research was specifically needed. So before this study, the hospital where this research was conducted did not implement a tool to screen for delirium daily or at all for their patients, and as a result of this, delirium was inconsistently recognized, and treatment often relied on these high-risk medications instead of using preventative measures. So they relied on these medications instead of just implementing a preventative measure to treat this. So the researchers recognized a need for a tool, some type of assessment tool to improve patient outcomes, which is where the confusion assessment tool comes in, the CAM-ICU tool. And by implementing this tool and training nurses to use it consistently, they hoped to improve early detection of delirium and reduce this unnecessary medication use. So this study did use an observational pre-test, post-test design. So what that means is these researchers compared patient data before they implemented this tool and after this tool was implemented. So they weighed data from both. So the subjects in this study included 463 patients from a 16-bed intensive care unit located in an urban academic hospital. And most of these patients were white and were not Hispanic, and there was an even number of men and women used in this study. These patients were categorized into high-risk groups and low-risk groups for delirium. So researchers collected patient data from their MAR, or electronic health records, before and after this assessment tool was introduced. They recorded medication use, the length of the hospital stay, and the outcomes of these patients. Nurses were trained to use this assessment tool, which was integrated into electronic health records and completed once every shift. The study used statistical methods such as control charts, chi-square tests, and mixed regression models to measure changes in any outcomes these patients had. So, what did the researchers find throughout the study? They saw a significant decrease in the use of these high-risk medications, which does suggest that this tool implemented helped clinicians recognize this delirium earlier on and how to manage it with safer alternatives. So they also found that each additional high-risk medication used was associated with a longer hospital stay, so the more medications they added on, the more it prolonged their hospital stay, which reinforced the need to minimize the use of these medications. Finally, these nurses reported that they felt just more comfortable with the idea of identifying and managing delirium after receiving hands-on training with the CAM ICU tool. So on top of this tool that they implemented, they also provided hands-on training and education modules for the staff that was having to implement it. That way they could get a well-rounded training on this new assessment tool that they were going to be implementing daily. And these findings do highlight the value of this tool and how it did ultimately improve patient outcomes. So, in conclusion, the study demonstrated that implementing the CAM ICU led to better recognition and management of delirium in intensive care unit patients, training nurses, and integrating a standardized screening process into routine care, reduced reliance on these high-risk sedatives, which ultimately did improve safety for these patients. And it supports the idea that simple, structured interventions such as delirium screening can have a huge impact on critical care, honestly, on any patient. Like simple little things that we can do, simple little interventions we can do as a nurse can have the biggest impacts on patients in these situations. And from a nursing perspective, this study does highlight the importance of early delirium detection. By using this tool, nurses can identify the patients that are at risk sooner than later and therefore implement these interventions that can potentially prevent complications like this. It also has its long-term benefits. So patients who experience prolonged delirium do have a higher risk of being cognitively impaired in the future. So it is vital that we recognize this early in order to improve these patients' journey to recovery and just their overall quality of life after they get out of the ICU. But of course, like any study, this one did have limitations of its own, so it was conducted and done in a single ICU, and so the results may not be generalized to all types of hospital settings. And since some nurses may not have documented every CAM ICU assessment that they performed, there could be gaps in the data somewhere. We just don't know. But despite these limitations that it had, it did provide a strong evidence that structured delirium screening and nurse education can lead to better, higher quality patient care. And as healthcare providers, we should continue to advocate for our patients and advocate for evidence-based practices that will create better outcomes for our patients, essentially. So considering like it was done in a single ICU, the data is small, but it is there. So delirium in ICU patients is a critical issue, but as the study shows, simple interventions like performing this can make a real difference in these patients' lives. higher than we think it could, and just taking these small steps to ensure that we are giving our patients the best quality care possible rather than just referring to like medications to treat them when it could be just a simple fix is so important. And it can definitely impact how we treat our patients and the outcomes that come out of this scenarios like this. But thank you for your time, and if you have any questions, I would be happy to answer them, and that is all I have.